Hi, my name is Dr. Annie Armstrong, head to toe spine and sports therapy. I had a really great question from one of my multisport athletes yesterday. She asked me, hey, when my IT band's really bothering me, should I foam roll it? And it's a good question because you can actually do some damage by directly foam rolling an IT band that has gotten a little bit inflamed, especially being especially careful with it near its attachment at the knee. So the IT band is a big flat band of fascia. It crosses over the knee and it crosses over the hip. That at the very top of the band there's the tensor fascia lata, which is a small muscle and is the only muscular portion of the IT band. The problem on the IT band comes often from its adherence to other structures in the leg. More specifically, it gets stuck on the vastus lateralis, which is your lateral quad muscle, and it gets stuck on the lateral hamstring, more so on the quad, especially in lateral knee pain cases. So if you've got this problem, go ahead and roll the vastus lateralis or the hamstring, trying to unglue the IT band from those structures, but spend very little time actually on the IT band itself, because you're very likely to make it much worse. When I'm treating this in clinic, I'm very careful with it. I do a small amount of work on it, but I spend most of my time making sure that the IT band is not glued on the surrounding structures, and making sure the hip is loose, and making sure that the lower leg and calf is loose. Same rules apply to your Achilles. If you've got an Achilles tendonitis going on, you've got to be really careful with the Achilles tendon. The Achilles tendon has a sheath around it which inflames very easily, and when this is a problem and you're starting to get pain in your heel, you've got to work on your calf, the muscle that connects into the Achilles, rather than the tendon itself, because working the tendon will most likely make it worse. A clinician who's experienced in treating soft tissue injuries can work around this really well and give you a good result with treatment, but you certainly need to be careful with it. So thanks very much, and we'll be back to you again soon.